on Leah, it's going to be uploaded. So concept maps are not a new tool for you. You've seen them before in MedSurg, so in 311 and 411. So the goal for the next, 10 minutes, 10, 15 minutes is to review the type of concept map that we will be using in 611 and what is expected of you of the clinical assignment that will be due eventually in February. So when we talk about concept maps in this course, we mean concept maps that are nursing care plans. So they're visual representation of a nursing process in a way of your patient, or a short form version of it. Because there are so many different types of concept maps, especially when you look them up and you YouTube them, you have to be careful because you can apply it in different ways. So, essentially what the concept map is going to help you is build your critical thinking skills, right? It's a visual representation. It's a diagram of your patient and their health issues. And from there, you're drawing connections between each system, each health issue. So it helps you sort of visualize the patient as a whole, to see them in a context, and to build your critical thinking skills. So really analysis, prioritization, these types of high-level nursing skills that you're looking to develop in your final semester in nursing. And we're going to facilitate that with concept maps. So we're going to look at a few examples. I have 3 examples of concept maps from previous years. They're not perfect. They're just examples. So don't use them as templates by any means. The purpose of this is just to give you an idea of what students have submitted in the past and the range of creative freedom that you have to make it your own. So we won't be using a template this year. You may have used one in previous semesters. So let's look at the first one. So the first one here is more of a traditional classical one. Student did use a template. You've got your squares. If you look at the lower right-hand corner, you have your little client profile, right? Let me just highlight that for you. So right here, so you have a patient who's 25, they're First Nations, Inuit. I know that for a fact because I worked with this patient. She has children, is unemployed, and lives with her boyfriend. So that's a little bit of the sociocultural data. If we go to the middle box, which is usually your central box, you've got your reason for admission, so the symptoms basically that brought the patient to the emergency. And in her case, it was severe right upper quadrant pain, fever, chills, vomiting, symptoms that you can't ignore. She was diagnosed with acute cholecystitis. That was her final diagnosis, and there were no differentials. And she got a cholecystectomy, which is a surgery, a removal of the gallbladder. So if you look at all the boxes that fan out of the central box, which is just a basic description of your patient, you have different health issues, right? Or problems. You have pain or acute pain secondary to surgery. You have risk of alcohol or ETOH, withdrawal symptoms. You have UTI as priority number 2. So there's a variety of them. What I want to call your attention to is the numbering system. So notice that your first priority problem is your higher level priority, meaning the one that is most likely to threaten your patient's life, anything related to the surgery, right? And then so on and so forth. So the student does prioritize each problem. So the number is not just simply an arbitrary number. It's really connected to assigning a level of priority to each problem, right? And this is where the analysis comes in. So, we can all agree that 10 out of 10 pain post-op is priority over, let's say, number 4, risk for infection, right? It's not even an actual problem. It's a potential integument problem. So that's one thing that's going to be asked of you, is to, after your head to toe assessments and your care of a patient on any shift during your stage, is to select the health issues or the abnormals in the systems that of your patient's bodily systems, and rate them in a priority fashion, right? Another thing that I want to call your attention to is below each of your, let's say your health problems, you have some information. What is that? That's data that supports your priority problem. So for example, here, patient has 4 laparoscopic sites. There's a little bit of oozing, etc. So there's some data that supports that this could be a problem, or that it could become a potential problem. So that's what we expect for you to include in these boxes. So the priority problems and the data that supports the priority problem. All right. The other elements of the nursing process will be on a second sheet, and it's more of a table, and I'll show you what it is. But this is the first part. Another thing is the red arrows. You may have noticed the red arrows. What do those symbolize? Well, they symbolize how one system can impact the other, right? And how they're interconnected. So you see that the student has drawn some connections here between different bodily systems and how one can impact the other. You can go one step above that and even print rationales as to why you're connecting priority problem 2 to priority problem 1. This can be discussed and worked out with your clinical instructor. So the next concept map looks kind of the same, but has a little bit more information. Same boxes, different diagnosis, arrows. For this patient, the student identified 1, 2, 3, up to, I believe, 7. Yeah, 7 priority issues. So you'll be expected to identify at least 4, and we'll go over the instructions in a bit. But there's 7 different things that are abnormal in their patient's head-to-toe assessment. And let's take an example here. Let's go with number 1, oxygenation, impaired ventilatory status. And obviously you can word this in whichever way you want. There's multiple ways to express altered oxygenation, right? As long as it's clear. So below that, you have a variety of data that supports that oxygenation is impaired. So for example, you have the patient having a tracheostomy, requiring PRN suctioning, decreased lung sounds, mild tachypnea, respirate 24 to 26. So these are all clusters, right? A list of data that supports the choice of this health issue or health problem, which is impaired ventilatory status. Okay. The last one I wanted to show you is a little bit different in formatting, and you can see that you can make it your own, and you're encouraged to make it your own and be as creative and as colorful as you want. This can be done by hand, by the way. It doesn't have to be done on Microsoft, or it could be done on Microsoft Word or any other software that you feel comfortable using. We're very flexible as long as it's clear. Yeah. So this particular concept map you see, it has a lot of, not that many boxes, but a lot of arrows and fans, and your priority problems are identified, but the data, for example, let's say imbalanced nutrition, the data is kind of fans out below the priority problem. So just to show you that you have a variety of ways that you can express or create a diagram or visual representation of how you're analyzing your patient's health issues. Okay, so there you go. So last thing I want to talk about is review the clinical assignment. So we'll go over the guidelines quick. I want you to read them on your own, obviously, and come with questions tomorrow in Zoom. So you have to select a client, first off, that you find interesting, that you find complex. You get that client approved from your instructor. Then you perform an in-depth assessment, which you would do anyway when you care for that patient. So head to toe assessment, reading the chart, looking at OASIS, all that, information, bringing it together, selecting at least 4 health issues. Doesn't have to be, like 8 issues like in the previous ones that you saw, but it has to be at least 4, or how many you think your patient has based on your clinical judgment. From there, after you've chosen your 4 priority health issues, you support that with clusters of data that back up the issue, as I had explained previously. Then you develop a nursing diagnosis, as you've done in the past and previous courses. So basic nursing process thinking. So an example of a nursing diagnosis is altered oxygenation related to a mucus plug in tracheostomy. Okay, if we're going to relate it back to that previous example. That can be inserted in your visual diagram. Then items 6 to 9, or rather 6 to 8, are going to be in a separate table, which I'm going to show you. I think it's in the next slide. Yeah, so it's going to look like this. You're going to reiterate the health issue that you drew out in the diagram, develop a nursing goal. Again, the usual type of goals that you would set in a nursing process, specific, measurable, time limited, realistic. Okay. Select some interventions that you did with your patient that day that are evidence-based. Client responses. How did your client respond to that intervention? Did it help? Did it not help? Was it effective or not? And then a little summary of the evolution of the this problem, right? The initial problem, 1 out of the 4 minimum. So what does that mean? That means, is the patient getting better, worse, or the same with respect to this problem? Okay. So let's go back. So that's for the last part, right, of the concept map care plan. The key purpose of it is the drawing of the links, right? So making the cross links between your different systems and how one impacts the other. You can add rationales in writing. You can discuss rationales with your clinical instructor prior to submitting, like verbally in clinical, that's fine. The whole purpose is to get you thinking about it, right? So this particular assignment is due on February 15. That's the deadline. Obviously, if you need some form of extension, we're open to it. Just let us know in advance. And as I said earlier, it could be submitted handwritten, printed, e-copy. You can use Microsoft or not. And in order to meet expectations, so in order to have a passing assignment, you need to get 65% or more.